Hello, Namaste. I welcome you all to this 26th session of Gurubodha. We have with us today Dr. M.B. Guraja sir, who has been guiding us all through these 25 seasons. So he's there with us. On behalf of all the participants, I cordially welcome Guraja sir to this class. Thank you very much for joining us.
Thank you, Dr. Janardhan.
I am Dr. Janardana Hebbar, founder of EasyAyurveda.com. Dr. M.P. Guraja sir is professor in Ayurveda College in Shumoga, and he's the owner of Dhavala Pentacare Ayurveda Treatment Center, Shumoga. He is my teacher from my BAMS days. So he can be consulted for health problems or to get case guidance. He can be consulted via the webpage easyayurveda.com/Guru Raja. Guraja. So coming to the topic, so this is a case treated by Dr. M.B. Guraj sir, psoriasis. Can you please take us through the case, sir?
Okay, this is one of the case referred from other doctor. She has been suffering from this condition quite long, and she has been taking Western medicines or allopathic medicines quite long time, but she was not having any relief from that. So when she approached me, then I straight away suggested certain medication for that. And usually in these type of skin conditions, I go by strict diet control and what should be eaten and what should not be. That is a very important aspect. I made them to eat only pure vegetarian diet, avoid all non-vegetarian things, and as well as even all oily, deep fried items. Anything which is oily fried, avoid all those things. And even the rich source of spicy masalas and these things should be avoided. So once I make them to eat only the bland diet of pure herbal source and even vegetarian type of things, and all non-vegetarian things and deep fried is avoided. And of course, with the medication, definitely the things will change. And this is a case wherein after 1 month of course without any shodhana, that is one of the important aspect I want to highlight, because even many times we feel that there are a lot of shodhana has to be done for skin conditions. But here in these cases, if they stick on to the strict diet, what we mentioned, and consume the medications and apply the things which is given to them, definitely the change will be evident and it can be seen.
First of all, so this you diagnosed it as a case of psoriasis, sir, and can you please explain like how do you approach psoriasis? Like which are the internal organs or dhatus and srotas that you concentrate upon practically when a patient is in front of you?
See, when it is for the purpose of easy identification, I use the term psoriasis because it's very, even for the counter people or population, they will understand only that word psoriasis. If I say it is Eka Kusta or Kitibha Kusta or Vata Kafaja Kusta, then they may not be able to identify it or recognize it. So for that purpose, I stick on to the standard pattern or universally known or accepted word psoriasis. That's the reason I go for it. Otherwise, it is typically a Kitibha Kusta, we can call it in Ayurveda, where the dominancy of Vata and Kapha is there. So in this case also, there is a clear-cut discoloration, there is a severe itching, scaling, and dryness. So dryness and scaling is due to Vata and itching is due to Kapha. So because of these two combination, the things are happening. So then when we convert, they change the things particularly with respect to by using colon cleansing materials, cleaning the bowels, as well as even changing the diet pattern and introducing blood purifying materials, definitely the things will change. And what we understand here is the important aspects where it is been hampered here in this case are particularly rasa, rakta, and to some extent it is typically lasika is also involved, or we can say it as rasa, rakta, lasika, to some extent even mamsa. So based on these 4 point, I usually concentrate on what medication we should select. So in this case, better I thought was Aragudadi Kashaya. The reason for that Aragvada Kashaya is a very good Kafahara as well as colon cleanser, and as well as it is very good against the itching. So that's why Aragvada Kashaya has been selected, and it is a classical preparation, Kafahara in nature and bowel cleanser, and of course one of the best Aragvada is one of the best Charmaroga Nashaka Dravya. So based on these parameters, I selected in this case Aragvada Kashaya 10 ml 2 or 3 times a day, depending upon the body weight. We'll usually calculate on that part of it, and severity of the Roga and Rogi Bala. Based on that characters, I'll select 10 to 15 ml. Then comes the important drug which I use it. That's a capsule Proskin, which is in oil extracted or lipid extracted material containing Guduchi, Katuki, Vasa, Nimba, Haridra, Jyotishmati, and even to some extent Mandukaparani, Manjista, Gugulu, all these things are there in this. This is one of the important capsule produced from Pentacare Air Pharma, which has it is in a form of a typically band sealed capsule. So it's a very typical one, hard gelatin capsule, but containing a lipid inside, and it has been sealed within gelatin coating. So that's what we use it. And this Proskin is one of the important material, which is almost having the content of Panchatikta Gulagruta with the fortification of added materials. So definitely it will going to improve the skin conditions. So because of it is Tikta Rasa and Gugulu, Gruta, and these combinations will definitely suppress the Vata to a large extent. So this drug I usually give this drug in cases of skin conditions as a before food combination. It is to be taken on empty stomach. So usually 2 capsules before food in the morning and 2 capsules before food in the night. That's the usual way of consuming. So this is the next drug, the Proskin. Next one is Psoherb. This is also containing almost a similar type of things, but it is a dry powder capsule, which I usually use it as a somewhat like a Samudka type of dosing. So before food, I'll go with Proskin like lipid extract, and after food, I'll go with the Psoherb. It is a dry powder capsule, so something like sandwiching of the doses. So in order to overcome the proper dosage required for the condition. Then for outside application, I use Kutaja Taila and Bruhat Dantapala Taila. Both are from 2 different companies, produced it based on the Banutapi type of Paka, that is from the Surya Paka type of material. They are not really boiled in fire. Both are produced from the sun exposure, cooked under sun. Kutaja Taila is containing only purely Stree Kutaja, Rhytia tinctoria, and Bruhat Dantapala also mainly contains Rhytia tinctoria, and along with that some Tila combination, as well as sometimes even certain Manjista and such type of drugs are also there. So these type of combination, when we use it on external application, definitely it will reduce itching as well as scaling. So when these combinations have been used continuously with a strict diet pattern, and we are getting a very good results, relieving itching as well as scaling, and even scarring also reduced even just a span of 1 month, even without any Shodhana.
Thank you very much, sir. Can you please throw some light on the formulation so her maybe what are the main ingredients or on which traditional medicine this medicine has been formulated?
Which one? Psoherb.
Psoherb, yes.
Psoherb is also a combination containing same almost Vasa, Panchatikta type of material.
And in other cases, as I have seen, you might use, say, Charmamrita powder and Proskin along with Gandhaka Rasayana. Again, in another case that you had shared, Grahadantapala Taila and Kutaja Taila both are constant. But some herbs keep on changing, and this is causing a little bit of confusion in the minds of the other practitioners. Like, how do you formulate? Meaning, how do you choose which one to use where?
See, definitely when we see the patient, whether the patient is a Medasvi patient, whether patient is thin in body nature, whether patient is suffering from this condition for a quite long time, whether intense itching is there, whether oozing is there, whether peeling is there. So based on those characters, see, if there is a oozing, then definitely it is involvement of pitta as well as kapha. So then we need to go for using particularly Dandakarasayana is to be added there. And many a times I go through the history when I take the history from them. If they have a tendency of consuming water or very less water, or they are having consuming many other things, then I need to control them or check them. So for that purpose, I use Charmamrita powder. It is one of my combination which contains Sariva, Manjista, and Khadira, Ushira, and Haridra and Tripahala in that. So that containing powder, I ask them to just take it to 2 spoons in 2 liters of water, boil it well, and then filter it. Then after filtering, use that liquid for entire day for the purpose of drinking. Don't drink any other water. You drink only this water throughout the day. So when I make them to drink this throughout the day, definitely it will help in cleansing their blood, and from there and it becomes to make it totally alkaline, and our body systems gets thoroughly cleaned. So that is the reason I go for with that. So it depends on typically the depending upon the patient needs and as well as the condition demands. Based on the condition, if it is severe itching is there, then I'll concentrate on that itching part to reduce it. If it is oozing is a more thing or peeling is a more thing, then accordingly. So here and there, that slight and might changes or understandings of adding Gandakarasayana or adding Charmamrita or deleting it, it will be there. Otherwise, it will be around these things. There are few kashayas like Mahatikta Kashaya, Pitarachakwata, Manjishadi Kashaya, then Aragvadadi Kashaya, Gugurtita Kashaya. These are some important kashayas are there. Around this only it will evolve. And among the capsules, of course, Panchatikta Gurta is there directly, or even I can go for the Pro Skin. And then for a dry thing, I'll go for many a times a detox capsule is there, and otherwise there is a combination of Psoherb is there. Then application is, of course, quite commonly I'll go for these type of psoriasis or Eka Kusta or Kitibha Kusta, these type of cases. Mahamanjista, the containing Vinsoria oil is there, or otherwise Kutajataila is there, or Bradantapala is there. So it's a combination of these things only. We need to just to understand, or we need to just to concentrate on these drugs only. These are quite efficiently, they have been designed and they are being used. And I am also quite confidently using them in many cases and finding a result. So that's why I depend on those drugs.
To sum it up, probably we can. It is safe to say that external application is for maintaining the to get rid of itching and scaling and the skin pigmentation and whatnot. So that is covered. So internally, whatever we give is one is say Rakta Shodhana, and straight away which are Kustahara or which are explained exclusively for skin, and which are say in the form of Virechana to be done, like bowel cleansing, largely bitter and Tikta group of herbs like Panchatikta Gruta or Pro Skin. So most of your prescriptions would revolve under these principles. If I'm missing, can you please add anything, sir?
Definitely. See, but the first thing is when Ayurveda is very clearly says about that anything which is produced in these type of chronic disorders, they are basically produced from the gut. So gut cleansing is a must. So in order to go for a Virechana, classical Virechana and all those things, patient may not be convinced many a times, may be having some constraint of the finances and many other even time and so many things. So they'll straight away agree for a simple way of Nityame Virechana or just simple bowel cleansing every day. That will be beneficial for them also and even for the practice. So I opt go for that. Usually I don't go for the classical way of Panchakarma doing Virechana and all those things, because many times patient may not be having sufficient money to resource to make the things to be done in that direction. So second thing is, once we do the cleansing, of the bowels in a proper manner, and we have made a restriction on a diet, very clearly the rasa and rakta getting dushana will be stopped. So once that is there, so we are somewhere put a break on the samprapti which is continuously happening. Then afterwards, what the drugs we are using, they're also avoiding the kavai gunya, they're also avoiding the cleansing the doshas, clearing the things, and automatically things will set right and the lakshanas will subside. So that's the reason Ayurveda has very clearly stated that we need to go for a cleansing from the bowel and then start introducing the drugs, so that definitely it will be helpful.
Thank you very much, sir. And one thing that I noticed was very logical use of Charmamrita powder example that you gave. We get so much engrossed with this kashaya and the tablets and this tablets, capsule and whatnot. We often forget about other forms of medicines that are that are usually advised. For example, there is this Paneeya Kalpana explained by Master Sharangadhara, and it was used even previously also. This would fit exactly somewhat there, like 1 part of herb plus roughly 64 parts of water, and it is like boiled and reduced to half. And this is not like exactly kashaya, which should be given only one time in a day. It's called as Paneeya, means it's kind of a herbal drink which the patient can take multiple times in a day. So probably this strategy we often miss. And also there is this muhur muhu way of giving timing of medicine, in which the medicines are given multiple times a day, for which this type of Charmamrita powder liquid that you are using. We sometimes get so much concentrating upon the market available medicines that sometimes we miss these kind of other ways of controlling the doshas continuously through this Paneeya Kalpana, etc.
Yeah, definitely. My intention was using that Paneeya Kalpana was just like Shadanga Paneeya, how we use it in case of a jwara. Similarly, if we use it, this type of Charmamrita type of material in the form of Paneeya Kalpana throughout the day, particularly for skin patients, then definitely it is going to help, because it's repeatedly the drug will be entering into the bloodstream and the concentration of the drug in the blood will be maintained, and definitely it will help in overcoming the samprapti.
Yes, sir. And I have learned to believe from Dr. Gurubodha, sir, that if you are an expert, you should not be hiding things. Your knowledge is worth sharing all the time, sir.
Definitely, knowledge has to be shared, because we also got our knowledge from our ancestors and our elders. Those acharyas, they are kept and given so much of GB of data they are given without any charging. So when they have given us all these things, it is our duty and responsibility to share it and to pass it on to the next generation. So it has to be given and it has to be shared. Once your knowledge is shared, then only people will use it, and then only it becomes very much popular, as well as it becomes an postulate, or it becomes a standard pattern, or even it becomes a theory. So we need to be in a very clear manner that we need to understand that it should not be hidden or something like that. That I'll make some preparation and I'll give my own pudiya and something like that, and that will be given to the only my patients. No, that should not be the criteria. Whatever that we are using it, it should become a theory, and that theory has to be converted into a practically approachable thing, and that everybody should do it. And when we get the results of simultaneously in the multi-centric things, then only we can say it is a science which is really acting in that place.
Yes, sir. There is a question here. What can be done for red eyes due to allergy? Even in case of simple allergic rhinitis, also we sometimes see red eyes, and maybe it may also be due to conjunctivitis. With important herbs, or how do you think about this, sir?
First thing, when a patient is complaining of redness in eye, we need to identify whether it is due to conjunctivitis, or whether it is due to really any allergies, or whether it is due to chinnashwasa, or whether it is due to any other issues. So we need to identify many things, whether it's any eye related diseases. So you need to check it out everything. Once it is very much clearly concerned that it is an allergy of upper respiratory tract associated with that allergic, then there is a sneezing, there is some itching or some sort of odd sensations on the face, and along with that there is a watering in the eyes and there is a redness. So in that condition, the best drug would be cleansing the eyes using Triphala Kashaya. Cleansing the eyes with Triphala Kashaya would be best, and internally consuming Bruhad Haridra Khanda would be very best to reduce the allergic parameters. So definitely these are the two important things. Still, if you feel patient is very weak and emaciated and related with this, if it is required, then you can go for even Triphala Grita can also be given to some extent. But the important drug would be Bruhat Haridra Khanda with milk in all those patients, and those who are having any allergy with the milk, they can go with hot water, and cleansing the eyes with cold Triphala Kashaya. Prepare the Triphala Kashaya and make it cold. Leave it, allow it to become cold, then use it for cleansing.
Yes, sir. And even in like very high pitta disorders, also kashayas, even if it is given orally, they are allowed to cool down and only then use. Especially I being a pitta thing, we need to be careful to use the cold kashaya for even cleansing that. And this Haridra Khanda and Bruhat Haridra Khanda, these are kind of very wonderful medicines, which we commonly use, starting from even skin-related allergies to respiratory allergies. It single-handedly manages, almost all sorts of allergies, sir.
See, reason is when everybody developed from the single cell in the fetus, the skin as well as the respiratory system is produced out of the same germinal layer. That is the reason we have a similar type of allergic parameters. There is a respiratory allergy in that person. If you suppress that respiratory allergy, then there will be skin allergy. So skin allergy and respiratory allergy will go hand in hand because of their germinal layer becomes unique and same. So that's the reason they will come with that. So whenever there is such type of thing, Haridra Khandam will be the best one, or Bruhat Haridra Khanda, that will going to be very, very good for respiratory as well as skin allergy. And it is a very wonderful combination our acharyas have given to us, and it gives a wonderful result also.
And what is the difference between Brihat and plain Haridra Khanda? I believe some ingredients are more in Brihat compared to plain.
Ingredients are more, and somebody uses low basma, and in some there will not be low basma, and some use a little bit of ghee, and some it will not be there. So such type of minor changes are there. Both would be good. Haridra Khanda plain or even Bruhat Haridra Khanda would be good for in this condition. If you get Bruhat Haridra Khanda, that will be better.
Do you ever use Triphala? May not be in this eye case. Do you ever use Triphala Grita for as eye drops, sir?
Now, usually I use Mahatriphaladya Grita internally in eye disorders, not locally. Usually I use it as internally, Mahatriphaladya Grita.
Okay. And can a psoriatic patient, can he take takra or buttermilk? Can you please recommend the takra recipe and dosage if you have any special form of takra?
Definitely, takra can be taken because takra is technically, if it is prepared after churning and all these things, it is not just by simply taking some sort of dadi, mixing it water and shaking it, make it light and it becomes takra. That is not the takra. A standard takra is the one which is being churned out and butter is removed, and then whatever that comes out, that is takra. And such takra, if it is taken, it will be ruksha and ushna in nature technically. So it won't increase the kapha. So it can be taken in case of psoriasis patients. And even I recommend them to consume it if they are habituated to eat something like curd rice at the end of the day, and they want to eat it. Without that, they will not feel that their diet is complete. For them, I suggest them avoid dadi. Go for the takra. So that can be done.
If somebody is asking, like, can you please explain more about Brihat Dantapala? Sir has already given it. I will share the slide so you will have it there. Moving on to the next topic is one of the widely used Ayurvedic herb, Yashtimadhu, known as Licorice in Western world. If you just go through the Charaka Samhita's categorization, so it is categorized as Jivaniya, Sandhaniya, Varniya, Kantya, Kandugna, Jardi Nigrahana, still like six, seven categorizations are there. So from the times of Charaka and Sushruta, one of the widely used herb, Yashtimadhu, sir.
Definitely, Yashtimadhu is having a multifaceted roles as well as it's from top to bottom. It will be used. It is a good for hair. It will be good for eyes. It will be good for throat. It will be good for the gut, respiratory system. It is totally. It is a wonderful, wonderful drug, and it is a multifaceted drug. And even in the present COVID situation, is also one of the important drug as a rasayana. It is a medhya rasayana. It is a very good to throat, and those who are having a lot of work related with their throat, like speaking or video jockey or radio jockey or even teachers or even the persons who usually use their throat and voice box in the more. So such type of people will definitely require Yashtimadhu. So it will be effectively while working on Udana Vata, and definitely this it's a very good drug for giardiasis as well as even the H. pylori problems, and even if it is a very good one on the hyperacidity, particularly the GERD, what we call it as the gastroesophageal reflux disease. In those conditions, it's a very good drug. And there is if it is any ulcers in the stomach or gastric ulcers, definitely Yashtimadhu is one of the important drug. And Yashtimadhu is used in the form of oil onto the head, which gives coolness, as well as it is a cassia in nature. So there are multiple roles, and it is very good for skin. And of course, Yashtimadhu is one of the wonder drug for the lungs and respiratory system. And of course, its versatility of this drug is that it can. It is that's why the acharyas have also included in many groups very clearly. Of course, there are some side effects are also reported nowadays, maybe because of the sourcing or the maybe because of separation from the alkalides or something like that. They are reporting some side effects also, like they have some bad effect on kidneys. Some say there is a little bit increase in the blood pressure. So such type of here and there the nuke side effects are there. That can be even managed, and it can be avoided if there is a such type of things. And such observations sometimes have been given where only the licorice is used, or when the glycerin is used. But the drug as a whole, the powder of Yashtimadhu, if it is used, I have not seen any problem till today in my patients.
Yes, sir. And like you told, I mean, one of the remedies in my BMS days that I learned directly from you is whenever there is like somebody is singer and has a mild voice problem, just take a small stick of licorice, Yashtimadhu, and chew it and swallow the saliva, so that it keeps on going in and it keeps on soothing the larynx and also the oropharynx.
Definitely, that's one of the important area where this drug works. Extensively it is used. There are many companies, they have come out with Yashtimadhu lozenges and Yashtimadhu in the form of Ghanavati, Yashtimadhu in the form of Churna. So many things are there.
And the interesting thing is with Yashtimadhu is it's often combined with Tripahala. Like Kottakkal Ayurveda has a Triphaladi Churna, which is just Tripahala plus Yashtimadhu. And we see the same combination, Triphala Yashtimadhu and Loha Basma along with ghee and honey in Saptamruta Loha. So probably for eyes, if we are concentrating, it makes sense to use it along with Triphala because Triphala is also good for eyes.
Definitely, we observe that type of combination and that those drugs are given where there is a pitta involvement is there, where pitta is a causative material and doing problem to overcome that pitta doshic involvement and the results. So in those conditions, usually this type of combination of Triphala and Yashtimadhu, these type of things are used.
When it comes to say acid peptic disorders, I would imagine this is like a classical Pitta Hara Madhura Dravya, which would be very useful when there is Amla Pitta with say high Pitta dominance, severe burning sensation in the stomach with say even in case of esophageal erosion also it is very useful.
Definitely. This is one of the wonder drug in those areas, because I have used it many other combinations in these type of conditions. When some of the cases I didn't get the results what I expected, then I changed it to one of my combination to using particularly this Yashtimadhu in the form of Ghanavati. then I could get a very wonderful result. And after that, I think a few years back, from that onwards, I'm using regularly whenever a patient, I suspect that it is a GRD, that it is a gastroesophageal reflux disease, and patient is complaining of gasping and even catching and severe acidity, pain, heartburn, and in those conditions, definitely I involve Yashtimadhu Ganavati, and the results are very convincing.
Which company product that you use, sir?
Yastimadhu Ganavati, I use it Pentacare. Pentacare has Ganavatis, a wide range of Ganavatis. So this Ganavati is having a concentration. Otherwise, simple Churna tablets are, I would say something like that 1:1 proportion, but these Ganavatis are usually 1:3 or 1:4 proportion in and that's why it's a very good, in a short, small dosage, we'll get a very good rich benefits, and that's why I prefer Ganavatis in that conditions.
Whenever the Ganavati tablet versus the normal like powder converted into tablet, I also have observed that the Ganavati tablet, which is prepared kashaya first and then converted into tablet, which is Ganavati, that acts more effectively. Probably the boiling and the water extraction makes it more concentrated. My mother, being like 76-year-old, she always complains that if it's just a powder tablet, it sits on it's very difficult to swallow, and that the granular outer surface would sometimes makes it difficult to swallow. So probably all things considered, Ganavati tablets are a little better than powder tablets, sir?
Yeah, definitely Ganavati tablets are more effective than simple powder tablets because of its concentration. In the same dosage of 500 mg tablet or something even below that, we'll get a tablet effect of more than 3 tablets in one. So that is the reason 1:3 proportion we get it. And another one important thing is that nowadays even these Ganavatis are also being little bit with pharmaceutical techniques are used for coating on the surface of the tablet with some excipients and all these things. And when these type of coatings and all these things are done, then they just like a smooth tablet. But of course, they also we try to keep the dissociation time intact. So as well as once it goes in and it very easily breaks open and it will be dissociated very easily, so that the results can be seen early. So nowadays it's not an issue with many major companies. They are come out with coating of the tablets, and it will be very thin coating, and it's called film coating, and it will be fine.
And regarding the Yashtimadhu being it Madhura Rasa Dravya, often it's used with the Ghrita and often it's used with the Kshira. Yashtimadhu Kshira Paka is also there. Should we be concerned about its kapha increasing nature? Should we be avoiding it in like severe kapha dominant people?
No, it is a Pitta Hara as well as Kapha Hara Dravya. It is not only increases the kapha there, but it expels it out. So that is the reason we use it. And it won't cause any problem in increasing the kapha when it is given with that. But our intentions are very clear. Whenever there is a high dominance of Pitta is there, then such combination with Yashtimadhu Ghrita, Yashtimadhu in the form of Kshirapaka, Yashtimadhu in the form of powder, if it is given, little bit locally there is an increase in kapha also, that will going to suppress the Pitta, the Ushnata of Pitta. So thereby it won't cause you any trouble there.
Yes, sir. And somebody has asked, how would you advise Yashtimadhu for gastric ulcers? My choice would be like Yashtimadhu Ghrita. Sir?
No, I go for Yashtimadhu Ganavati, then comes Yashtimadhu Kshirapaka, and Yashtimadhu Ghrita in the last option.
Because it is having medhya action, meaning improves the brain power, concentration, and all. So I would use this, especially the Yashtimadhu Ghrita, in case of like a mania, or person is highly aggressive, repeated anger episodes, and all associated with a manic depressive psychosis, wherein patient goes up and down with his mood. So it is a very good unique Medhya herb as well, sir.
Definitely, it is one of the important Medhya explained even by Charaka. Yashtimadhu in the form of Churna, it is considered as a very good one, as a Rasayana Dravya as well as Medhya Rasayana. And of course, during even COVID times also we have seen Yashtimadhu is doing wonders. We have used in many of the patients with all these symptomatic things. mild viral form of complaints. So in this condition, when we use Yashtimadhu, it gives a wonderful result and soothing effect to the body. Of course, it also has a special effect on the brain. The person, by afflicting this COVID or something during the period of COVID, something like that, that fear will be also just taken away from him, and he will feel comfort by consuming Yashtimadhu in that form. In Yashtimadhu Kshirapaka, Yashtimadhu Kruta, Yashtimadhu Ghanavati.
Yes, sir. And one of the things that has been explained even by Master Charaka is it's a Shukrala action. To translate it to English terms, it would be like increasing the sperm count and improving overall semen quality. Very good. You have to use there as well, sir.
Definitely, that's what I said. This is one of the multifaceted drug. That's what my opening statement was. It can be used in all the tissues. It is having effect on rasa, it is having effect on rakta, it is having effect on mamsa, asti, medha, shukra, majja. On all the tissues it has effect. That's the reason it has been included in many groups by Acharya. And it is one of the important pittahara and kaphavardhaka as well as vrishya dravya. Definitely it will be good even using in sperm related issues and even with the vrishya karma purposes. So it is one of the wonderful drug.
Even sometimes the concept of Risha has to be taken in the mental aspect of the patient. Like patient is too much anxious to be successful all the time, or worrying about too much egoistic attitude, worrying about sexual performance. That also increases the anxiety, which would also affect his sexual life. So this should work both on the Shukra Dhatu as well as in his mind. So
definitely it will work on both the lines. It also gives a soothing effect on his brain as well as his performance on the sexual grounds. So it will be fine for both the areas. Single drug acting on both the areas.
And how long generally Yashtimadhu or Yashtimadhu containing medicines be used? Should we be what areas we should be taking care while we are using it for like several months?
See, only because of various claims being made as a side effects, particularly related with the kidneys as well as hypertension, only those two aspects has to be kept in mind as far as my knowledge goes. Just repeatedly, randomly, if you check it up, if it is any problem related with increasing of the hypertension or the blood pressure or something like that, that needs to be checked upon. Then comes the any patient suffering from any kidney related diseases, just have a look on that, on those areas of creatinine, urea and those things, maybe periodical evaluation. Otherwise, it can be taken continuously because this is not going to cause you any problem, as this Yashtimadhu is considered as Rasayana Dravya, and Rasayana Dravyas can be taken throughout. So there is no restriction for its usage. It should be taken for some time and it should be left after that. No such restrictions are there because it's a Rasayana Dravya.
And if I'm not wrong, Western countries they usually advise to avoid it during pregnancy, probably due to the blood pressure issue. But in the Masanumasika, Garbhini Charya, I mean, the diet and regimen told for the pregnant mother, it is used quite frequently. Probably in lower dose, it would not cause anything. And another thing is that we should use the herb as it is, not just the extract like glyceric acid or whatnot. So.
Definitely, we should not use the extracts of the drug. We should use the drug as a whole. And if you use the drug as a whole, nothing will happen. And of course, for Yashtimadhu, there is a limitation in the dosage. If it is beyond 1 gram, then there may be chances of causing a vomiting. Or it causes, it's because it's a Vamaka Dravya. We all know it. So that should be taken care while using it. That's the only area we need to concentrate. And for pregnant women, then also it can be given. There will be no harm in it, provided only it doesn't go beyond the limited dosage area where it has been prescribed, not beyond that.
And it being used in Vamana very frequently as a co-prescription or a Vamanopaka Dravya. Yashtimadhu phanta is advised after say Madanaphala is given repeatedly. Patient is made to drink so that he gets volume in repeated vomiting. I sometimes suggest this technique of using just the phanta alone in a very high dose as a modified form of Vamana when Ayurveda practitioners from Europe or America approached me because standard Vamana is forbidden there. Probably this Yashtimadhu phanta higher dose, maybe adding with a little bit of vacha would be okay-ish. So,
Definitely, that can be done. That modifications are always, because see, when we go with the technical terms and technical way of doing it, and there is a legality of binding or prohibition is there, then we need to change the protocol. That's the reason how we need to introduce the things to them. So then you can go with high dosage and rich concentrate of Yashtimadhu Fanta added with some vacha and even Saindavalamana to that. That will give you very wonderful emission.
the yoga practice of Vamana Nauli is there. Rather than using that, at least this is like more closer to Ayurveda. Rather than that, using this would be better one. Like
Definitely, this will work as a Sadhya Vamana. There is a concept in Ayurveda also. There is a typical way of doing Vamana. That is classical way of Panchakarma Vamana is there. In that, there is another method that is called Sadhya Vamana. In Sadhya Vamana type of material, we can use this combination with Yashtimadhu Fanta with little bit of vacha and as well as Saindavalamana into that.
And regarding use of licorice in the form of thaila, it is frequently used in many herbal oils which are used for hair and also for skin. On the hair, especially whether it acts only on the scalp or it has action on the hair to improve the hair quality, shine, and whatnot.
Definitely, it improves the hair growth as well as, see, when we have a problem of hair fall, we try to analyze what is the reason. And one of the important reason for hair fall is increased pitta. So when there is an increased pitta, there will be hair fall. So in order to overcome that pitta, we need to select a drug which is Guru Shita, cold in nature. So one of the Yashtimadhu is one of the important drug which can be used in that condition. And of course, it is supportive to the brain as well as Medhya Rasayana, and even it is coolant to the head. So all these will definitely will work out. So that's the reason whenever we use the Yashtimadhu in the form of thaila, it not only helps the hair follicles, skin and scalp, it also soothes the internally at that local parts like Uttamanga or Shiras. So it is very good one, and that combination will definitely help in bringing down the aggravated pitta.
And there is a question here regarding Yashtimadhu is safe for Garbinis as it is Vamaka. I mean, in a very high dose, like Guru has told, more than 1 gram would be, we need to take care. But usually it's not used alone, and it is always, even in the Masa Masika Charya also, it is made into a combination. For example, licorice along with the Maduka flower, and so that is given with butter and honey in the first month of diet. So I mean, as long as we are taking care of dose and we are actually seeing the patient and observing side effects, if any, we are on the safer side.
See, definitely in pregnancy, there will be naturally first trimester, there will be chances of vomiting and all these. It's a pregnancy-related vomiting. It's a very common complaint. Even without any drug, there will be vomiting. So she'll be just by the sight of food, she'll be having vomiting sensation, nausea. So we can't simply say that because we are given some Yashtimadhu and it produces vomiting sensation. It is not like that. It is because of the condition. So there are people where they have a hyperemesis gravidarum, we call it as. Throughout the pregnancy, there will be problem. They'll have a vomiting sensation every morning. There will be morning sickness and they'll be vomiting. So that is a type of patients and their conditions, and that is to be addressed accordingly. But by giving Yashtimadhu, it won't increase their condition. Definitely, if you analyze and they understand there is a pitta increased in the body or at the level of Uttamanga, then if you are interested to use the herb which can cool it down, then Yashtimadhu is one of the choice.
And regarding its use as a rasayana, wherever probably tissue building is required, like post-tuberculosis patient or chronic lupus, or even in like osteoarthritis with the old people, in those cases, it can be given as a kind of a rasayana and tissue rejuvenating herb.
See, this is one of the important Sandhaniya Dravya, as mentioned by even Charaka. I have observed and I use these in particularly gastric ulcers. So ulcer is once again we call it as a discontinuation of the anatomy, and that is nothing but it may be even in case of a fracture, it is almost same. So it is astibhagna, it is mamsa. So anywhere in these kind of when we consider this as a bhagna type of thing, there is a discontinuation. So in those areas, Yashtimadhu plays a very important role, and Yashtimadhu in particularly with in cases of respiratory system issues, particularly there is an we call it as urakshata. There is one condition. There is a damage or the tissue damage or even the injury to the pulmonary tissues. So in those conditions, definitely it has a very important role to play, and once we use them, definitely the improvisation takes place very rapidly, and the tissue rebuilding occurs very fast. So that is a very clear natured material, that is rasayana, and it is very good for the stomach as well as the respiratory system, and even where there is a wear and tear. So in those wear and tear areas, definitely it can be used.
Regarding wherever I required to use spices, but patient is having very sensitive stomach, maybe due to gastritis and all. I would use, and wherever Tikta Dipana is not much useful, I have to use, say, Hingwastaka Chuna, Aptikatu Chuna, etc. Even Pipali, for example. I would use Yashtimadhu as kind of a buffer or a hedge or a balancing herb to counter any excessive pitta aggravating effect. So that's a good idea, sir?
You say that can be made, but when we are using or mixing two herbs which are with quite contrast virya, sometimes may not go in hand. So if you are combining any such two drugs, try to get any information from the classical text where our acharyas have made the combinations, and in those combinations somewhere if they have mixed these two drugs, then don't hesitate to mix. That is our idea or the base for that. If acharyas have never mixed these things, then don't do it. See, very clearly acharyas have said, whenever you are using shilajatu, don't mix up kulatta. Very clearly said. But unfortunately, some of the companies, they have come out with a drug in a combination with kulatta, shilajatu, punarnava, manjista, everything has been added into that, and targeting on the urinary system. That's a very wrong way of presenting. That may, because it is not going in the line with our acharyas have described it. Our acharyas have given various combinations. Try to analyze those combinations. Whether the acharyas have put all these drugs together, then you also make a combination which is very similar to that. Otherwise, sharp acting or penetrative drug which should not be taken against a mild acting or a counterproductive drug to be mixed with and making a combination that may become virya viruddha and may be counterproductive instead of giving good results. You should be very choosy in selecting those combinations.
Thank you, Des. And there's a question here. What herbal combinations can be used for post-COVID coughing lasting for few months? Also, there is emaciation. So post-COVID coughing lasting for a few months with emaciation.
If a patient is not diabetic, then the best combination would be Kushmand Rasayana and Yashtimadhu Ganavati. Kushmand Rasayana and Yashtimadhu Ganavati will definitely bring in the change in these conditions.
Whenever there is like chronic respiratory tract disorders, including asthma, in tuberculosis is very evident. Usually, patient start losing the tissues, and there will be severe dhatu kshaya where Yashtimadhu with say Kushmanda Rasana that you told, this combination is kind of very effective. Sir.
Definitely, and if a patient is diabetic, then avoid Kushmand Rasayana. Instead of that, you go with Yashtimadhu Ganavati and Ashwagandha Churna in the form of Kshirapaka. Yashtimadhu and Ashwagandha in the form of powder, and mix it with Kshira, make it a Kshirapaka Vidhi, and then that is better to give it, and it will not going to increase the blood sugars, but they definitely have a beneficial effect on tissue rebuilding.
Yeah, and There's a question, what would be the dosage for Yashtimadhu for different reasons? I think we have covered. I mean, if it is like Grita, standard Grita dose, and like if it is Vati standard Vati dose, would be this one. Any point to add?
All the doses should be according to the classical preparation dosage formats that should be used, not beyond that. Only concentration is that as a single drug, when you are using it, Yashtimadhu, don't cross 500 mg. You make a tag on that 500 mg is sufficient and it won't cause any problem. Once beyond 500 mg, then there may be in some patients, there may be some sort of nausea and vomiting.
And regarding its use in alopecia areata, Yashtimadhu oil in particular, is it having any use, sir?
No, it's one of the good herb. It can be used in that, but to be specific on alopecia areata, better use Mahanimba Taila instead of Yashtimadhu Taila. Mahanimba Taila will be more beneficial in that.
Okay. Most of the people who treat alopecia areata, they would consider this as a krimi. They would seek for krimi hair action along with like twacha action together. So
Yeah, definitely. It is to be treated in that sense.
this is kind of a unique question. So when hair loss occurs on the eyebrows, so that only half of the eyebrow remains and the hair won't grow back, what does that indicate regarding their health?
See, it's very clearly loss of hair from the places where there is a hair. It may be mustaches, it may be beard, it may be head, it may be scalp, it may be eyebrow. All these comes under the category of alopecia areata. So if it is, you just to try to find out whether it is alopecia areata, observe the pattern of hair loss, whether it is the shaft of the hair is broken or from the follicle itself the hair has lost. So if it is alopecia areata and half of the eyebrow is lost, then same what we used as a drug of combinations like Mahanimba Taila and such everything, Narasimha Rasayana and those things, which can be used even in there. And wherever that type of alopecia areata is there, then it usually the patient will have some sort of hormonal as well as immunological deficiencies and issues with their body. So that needs to be corrected.
Yeah, I mean, the alopecia areata can also happen in mustache and even beard also sometimes.
Yes, definitely.
And yeah, like I told, in cases of like testosterone deficiency, also I have seen a very severe form of alopecia areata. Yeah.
That's what hormonal issues as well as immunological issues. Two areas will come into concentrate when there is alopecia usually.
Okay, so that's it for today. On behalf of all of us, the students, I thank you very much, Gurubodha sir, for making this wonderful session.
Thank you all for your patient listening.
Thank you all. See you in the next class next Sunday. Namaste.